Hi, this is Dr. James Reade, chiropractic physician and certified functional medicine practitioner. What are the 5 basic characteristics of fibromyalgia? Well, one would be chronic widespread musculoskeletal pain, so your muscle and joint pain throughout your body in multiple areas. Number 2, increased pain sensitivity or pressure. So you can touch lightly on someone and there's a lot of extra sensitivity to touch and pressure. Number 3, fatigue. So just chronic fatigue. No matter how much you sleep, it's always you're tired and fatigued. You have no endurance. Number 4, sleep disturbances. So difficulty getting to sleep. Also, you get to sleep, but you wake up quite a bit. And lastly, number 5, cognitive impairment and brain fog. You just don't have that focus. Mentally, you're not sharp or have that clarity. Those are the basic 5 characteristics of fibromyalgia. Fibromyalgia is a very difficult condition to actually diagnose. What kind of symptoms are actually associated with it. So we're going to go over just some other associated symptoms of fibromyalgia. One is anxiety. How about depression? Just muscular spasms and tightness. Pins and needles. How about weight gain? Increased sensitivity to cold. How about also irritable bowel syndrome? A lot of times problems with the jaw, temporomandibular joint, obviously chronic fatigue, headaches and migraines could also be part of fibromyalgia. Constipation, diarrhea, dizziness, and even excessive bowel gas can all be associated with the condition known as fibromyalgia. So what are the different conditions that may lead to fibromyalgia? Maybe you experience, some problems with Epstein-Barr virus or some other flu-like type of disease or virus. It could also be exposure to the Lyme's organisms as well. It could be physical trauma. All right, that's never been, fully resolved and so on. There could be some pre-existing problems with your joints, like having rheumatoid arthritis. Another one could be a hyperlaxicity of your joints, okay, or weakness of your ligaments. How about past psychological trauma, okay? It could be way back in your childhood, or it could be more recent. So it could be, physical or verbal abuse. How about just a lifestyle where you don't exercise at all, so a sedentary lifestyle. And of course, one of the other triggers or things that can lead up to fibromyalgia is obesity. So there you go. Those are some of the things that can actually contribute to fibromyalgia. So there are many things that can actually lead to or worsen fibromyalgia. I'm going to just list a few. An issue known as leaky gut, or any associated like food sensitivities. Problems with your microbiome in your gut, neurotransmitter imbalances, which are the chemicals in your brain and your nervous system. We also find mycotoxins, so those would be some of the things that come from molds and fungi and yeast. Bacterial overgrowth in your gut, which can lead to small intestinal bacterial overgrowth, which can cause other problems because they're waste byproducts. Lipopolysaccharides can be a problem. Adrenal fatigue, long-term daily stresses, lack of sleep, not enough glutathione, which is the main anti-inflammatory antioxidant. There could also be some genetic predispositions, your exposure to heavy metals and mercury, and of course thyroid imbalances. So these are all things that you should consider if you're looking to go ahead and get some relief from some of your fibromyalgia problems. So with fibromyalgia, what can play a big part of it is autoimmunity. Now, what is autoimmunity? Well, briefly, this is where your own immune system begins to inflame or attack your own tissues. Now, with fibromyalgia, you have to remember it can affect some of the nerves in the periphery. It can also affect your spinal cord and also the brain. But in addition to that, it can also affect some of the other tissues in your body, such as your muscles, your connective tissue or fascia, and even your joints. So just go ahead and keep that in mind with fibromyalgia, that autoimmunity can play a big part. So did you know that, fibromyalgia is not just about your muscles, okay, and the nerves that might be in your muscles or connective tissue like your fascia, but fibromyalgia also consists of having problems with your central nervous system, so it could be the brain. So really, if you want to kind of boil this down to, you can think of fibromyalgia as a condition that affects both your body and your brain or nervous system. Of course, I just want to summarize it. It has a lot to do with inflammation, and it involves inflammation here, of the nervous system and the brain, throughout the body and the periphery. Also inflammation of the muscles, your tendons, your fascia and joints. So the key is try to figure out what is causing some of that inflammation. Is it, due to a problem with, let's say, with autoimmunity? Is it an issue with adrenal fatigue or something along those lines? Is it mycotoxins? So having the appropriate testing is really crucial and important. And that's what we do here at our office, is try to do the detective work to figure out what is causing that inflammation. So what are some of the basic pharmaceutical approaches to fibromyalgia? Well, one would be antidepressants. Number two would be anticonvulsants. And number three would be opioids. And I know in some cases they try to use non-steroidal anti-inflammatories, but they have kind of mixed results, and sometimes they don't seem to be super effective. Some other things that maybe you're not fully aware of if you have fibromyalgia, but there are some other treatments that you could consider as well too. One would be, how about chiropractic treatment? Yes, that can actually help in a lot of different situations and so on. Acupuncture might also be another thing to consider and think about. Also, different types of massage. Okay, you may not tolerate heavy massages, but maybe some lighter types of massages. And even cognitive behavioral therapy might be another thing to consider as well too. Because again, you're dealing with the body and also the mind. So what are some of the basic things that you could actually do if you have fibromyalgia? Well, one of the key things is try to see if you can get in a habit of getting your usual 7 to 8 hours of sleep. Try to go ahead and see if you can begin a type of exercise program, even if it's getting out just to walk and so on. Also, another thing too is kind of analyze what seems to trigger a lot of stress in your life and see if there's some ways that you can begin to manage this. And also, more importantly, see if you can identify certain foods that have a tendency to inflame you and cause problems. And you really should go ahead and eat a diet that's actually more organic, and one that actually is one that you actually eat real food and not processed food. I'm Dr. James Reade, chiropractic physician and certified functional medicine practitioner. I've practiced over 30 years. And with people that have fibromyalgia, it's important to go ahead and do the proper testing to try to find out what the problem is, because not everybody's fibromyalgia is the same. So doing the appropriate testing, and we do have that here at our office, to try to do that detective work and figure out what it is that's causing your particular problem is very important. Also, I want to direct you to our website. We've got a great content on multiple different types of topics, including fibromyalgia. And if you're interested in being evaluated and you're looking for some sort of health care and treatment, please contact my office at 480-732-0911. Thank you.